So today we will see how to diagnose a dengue infection or how to read a dengue report. For diagnosis of dengue infection, basically there are three methods. Either by detection of antigen or detection of antibody or by detection of RNA by PCR methods. So what is antigen? Antigen is nothing but basically the part of the virus that will elicit an immune response in the patient's serum. That will lead to the formation of antibodies in the patient's serum. So in case of dengue infection, it is the NS1 antigen or non-structural protein antigen, and this antigen is formed very early in the course of illness. So you can detect this from day 0 to day 5 after the onset of symptoms. Another thing is antibody detection. Now these antibodies are formed in response to the antigen or virus in the patient's serum. So it will take approximately 1 week to develop in the body. They are again of two types, either IgM or IgG. IgM are early antibodies, they form early and signifies acute infection. So you can detect them from day 3 to day 5 and they can persist up to 2 to 3 months in the patient's blood. IgG antibodies, they form late and they signifies chronic infection and they usually form after 14 days of onset of illness. Sometimes you will find both present, that is IgM and IgG present in the patient's serum, and it signifies a current infection. So if you perform this test in the first week and it comes out to be negative but you are really suspecting the infection, then it is advisable that you repeat the test after 7 to 10 days because body will take some time to produce the antibodies. Third type of test detect the RNA from the virus. Now we use molecular test, that is PCR methods, for detecting this RNA, and this RNA is also present in the first 5 days of illness. Now how you diagnose these antigens or antibodies? For NS1 antigen, we can either do rapid CART test, also called as rapid immunochromatography. The results come very fast. It is within hours, and another is the ELISA method. But the sensitivity of rapid methods is very high, though specificity is not very high. Now detection of antibodies can be done by ELISA method. For RNA detection, we have PCR. PCR is a very specific test. Now let's see some of the reports of dengue. This is dengue NS1 antigen report. Here antigen is detected and the method is rapid CART test, that is rapid immunochromatography. The result is negative. So early in the infection, if you are doing it 0 to 5 days and this is coming out to be the negative, then there are chances that the infection is not dengue and something else. Now let's have a look with another report, that is antibody report. This is the antibody report where we have dengue IgM. Dengue IgM in serum, the result is positive. How we see that the result is positive? There is a reference range in case of ELISA methods. This is done as ELISA, and ELISA gives you a reference range. That is, if the value is less than 10, then it is negative. If it is 10 to 11, then it is equivocal, and if it is more than 11, it is positive. So the value here is 66, which is more than 11. We consider it as positive. Now what is equivocal? Equivocal is nothing but a borderline result where the result is not clearly negative nor it is positive. So what you do in these cases, it is better that you repeat this test, preferably after some time, after few days. So you get a conclusive report, either positive or negative. And at the bottom there is some interpretation. You can read this interpretation to understand the methodology of the test. Now this is dengue IgG report. So we have seen that IgG forms later in the infection. Dengue IgG is negative in this case. It is 12 because the index value is less than 18 is negative. So if we consider this report as a report of the patient where IgM is positive and IgG is negative, then you can think that it is an acute infection or early infection where IgG antibodies are not formed but IgM antibodies are formed. Now let's see the third report, that is the PCR report. When you get a PCR report, it is written like dengue and chikungunya detection by PCR. Dengue can be done separately as a PCR or it can be done clubbed with chikungunya also. So in this case, dengue virus RNA is detected. Chikungunya virus RNA is not detected, and method is RT-PCR qualitative. Qualitative because they have not given any value here. They have just told you that it is present and it is not present. If you go for a quantitative method, they will also tell you how much burden of virus is there in the blood. They will give you a value that this is the virus load in the blood. But since it is a qualitative test, they have given that dengue is detected and chikungunya is not detected. Then there is some interpretation. There are some other tests which we call as POO test, Parexio of unknown origin. This is also a PCR based method and it has a panel of infections which may include dengue, chikungunya, plasmodium that cause malaria, salmonella that cause typhoid. So when there is a fever, which the doctor is not able to understand what can be the cause, there are multiple causes, then they can order a panel, that is PUO panel. This is a costly investigation, but it covers a lot of parameters. I hope you have understood how to read a dengue report by now. Thank you.